Okay, good. So when you're looking at this, you're looking at a blank screen. We start in about 3 minutes. And this is when I give instructions because we are going to have part of this that is going to be seen by YouTube. We are now out of YouTube jail, so you will be seeing it live. Because we did say something that it offends the censors. Doesn't offend the public, but it does offend the censors. It's like I'm not going to talk about the article from this news station that said the dominoes are falling. The New York Supreme Court strikes down the COVID vaccine mandate for all New York public workers. I'm not going to talk about that, even though that is fact, and it really did go by, because we can't talk about any of that. I already was put in YouTube jail. The videos will be posted on YouTube last week, but you couldn't see it live because the social media is doing everything it can to suppress free speech. Yes, comrade, don't worry. As long as the government decides what you can think, it's much better. Takes all of the stress off. So you can't say anything about this or this. That's actually how I got kicked off of TikTok. We had like 99,000 people, and it was kind of fun. I was really enjoying the TikTok videos. And I was gesturing with my finger and thumb like someone was shooting me in the arm with something. And I said, there's certain medical interventions that are causing, and then I mentioned like inflammation and cardiac stuff, and they took offense to it. So they wiped out our channel. Yep. Welcome to True Health Tuesday, and the truth will set you free. And it's going to set even those bastards that are squelching the truth. Okay, tonight we're going to talk about last week we talked about cervical spine. Now we're going to talk about the thoracic spine. And it's weird, but we got to break it down. And, well, I mean, I like this. John F. Kennedy. The rights of every man are diminished if the rights of one man are threatened. That's why I can't really bring up this, but there was a major court case right now that happened yesterday in New York that is protecting the public workers from a forced medical procedure without informed consent. Now that, whoa. Okay, good, now it's working. John F. Kennedy. Now, it's kind of neat when this was, when he said this, October 1960, let me see, May, June, July, August, September, October. I was 6 months old. Don't look at me that way, I'm not that old. If this nation is to be wise, well, and strong, we are to achieve our destiny, then we need more new ideas for more wise men reading more good books in more public libraries. These libraries should be open to all except the censors. We must know all the facts, hear all the alternatives, and listen to all the criticisms. Let us welcome controversial books and controversial authors, for the Bill of Rights is the guarding of our secure society as well as our liberty. Wow, the Bill of Rights, free speech, okay, freedom of the press, well, I mean, most of the ones that were taken away the last couple of years to flatten the curve. But he's right. All we got to do is follow this. Now, the censored portion, we are going to have some valuable information that I can't talk about this. All those that are on the Dr. B VIP, thank you for supporting us. We've been demonetized and shadow banned for 3 years. Now, the apprenticeship program, which is 90 minutes long, it happens this coming Thursday at high noon. We're going to be covering how to reverse arthritis, but it's doctorate level education worded down to normal people, so that I can understand it. It's really cool because if you figure the medical system is separated, you know, by calling, you know, metatarsalgia, what did I just say? Foot pain. Extreme Health Academy. I did a 2-hour webinar with them this past weekend, Q&A, just phenomenal. You can still get on there for 2 weeks for no charge. It's called Bergman 14 is the code. Let's get into this. Now, the reason, and this is one of the insane things in society that we have today, is people are concerned with symptoms. Now, 90% of the nerves that come off this spine, there's no pain fibers. So if you know that from the side, it should be balanced. The skull should be balanced over the pelvis. You have a curve here, a curve here, and a curve here. And it's like that, so it's fantastically strong. Now you'll see the vertebrae are 3 different shapes. We actually had one of our things to master our palpation skills, which, let me tell you, it takes forever. It's like mastering golf. You had this bag of bones, which is an articulated spine, and you had to put your hand in there, grab one bone, and decide whether it was cervical, thoracic, or lumbar. Then you had to know which level. Go on, say it with me. Whoa, dude. Okay, it sounds harder than it actually is because you start to recognize the features, and you get out. I could always get within one, okay, or if not, getting the real one. But also, if that head goes forward, all the muscles that support that head stop in the thoracic area. So it's hugely important that this gets paid attention to. Now, when we look at this, if the body is off to the side, you've got these ribs, and the ribs, you've got a super mobile cervical spine, super mobile lumbar, and an immobile rib cage where you have these giant cranes coming off called arms. Now there's only one bony attachment for this arms, and there's 18 muscles that hold it to the rib cage. But the ribs themselves stop here. So right about the middle where the nipple is, okay? Now it comes down, and from here to here, there's cartilage. So people all the time, and we get so many motorcycles, wrestling injuries, everything, they'll say, yeah, man, I broke a rib, and they'll point right here. And I'll say, I highly doubt that you broke it. No, it's really, really sore. That's the junction of bone and cartilage. This is called a costochondral junction. It almost never breaks there, but it will subluxate. It can be knocked out of position. It's so flexible. Imagine if you had a chicken bone on a trampoline, okay, or a beef rib bone, and I said, okay, go break it. And you're going, boom. Okay, you know, it's going to be all springability. It's not going to work. And that's kind of what this is. Broken bones happen in the mid area here, because that's the area where they're wide, flat, and this is super common, where you can hit some type of an impact injury and it'll fracture. Super common, but not here. But there, if you've ever had a costochondral sprain or strain, for sure there's going to be some kind of an issue because the cartilage has very little blood supply. So the way to fix this, in some of the times, the cartilage and the bone will be actually separated. This is the tough one. The chiropractor's got to go underneath the rib cage and pop it out to realign it. Now, generally, the people we're working on are contractors, tough guys, and frankly, you don't mind hurting them, you know? It's like, buddy, this is going to hurt. They know it's going to hurt. You know, guys are used to withstanding a little bit of pain, and if they cry, I got tissues. Okay, but when it happens to a girl, you know, it's like, dear, it's going to be okay, honey. It's going to be, you know, it's hard. Yeah, girls' tears are like kryptonite. Yeah, it really is. It's like, please, hon, I'm sorry. But also, you can see here how there's a distortion in there. Now, just think of this. All the muscles that support the head stop just a little bit down below the top of the rib cage area. Now, the ribs come around and attach, literally go in along here, hit this part that's sticking out called the transverse process, and they come along in and they touch the vertebral body. Now that's the rib head. And I cannot tell you how many people come in and they go, yeah, I got a rib head out. I thought, wow, that'd be kind of unusual. I'd like to see that. Because the rib head, okay, now when you look at this, you've got about 2 inches of meat here, okay? And then this is like the filet mignon or the T-bone steak, okay? So you've got a whole bunch of muscles here, and the rib comes around here. So you're looking from the top down to the rib head. It's on the front of the vertebrae, okay, the front of the transverse process, and under 2 inches deep. Now, rib heads don't get knocked out. If they do, you're probably dead. okay, or there's such a distortion. But what will happen if this vertebrae rotates or twists or spins, it's going to be more prominent, okay, and that's what we'll see. And I'll try and explain to the patients, no, it's not the rib head, but you do have a massive thoracic rotation. Okay, and that makes sense. It's just understand that there is a lot of muscle back there. And these are muscles that actually aren't under conscious control. So you can see here's a couple of patients. And just think of this. You've got ribs coming around here. And at the top of the rib cage, it's shaped like a cone. So you can carry a huge weight on the shoulders. I mean, when I was a kid, it was 16 foot long 2x4s, and it's designed to hold that. Okay, everybody is in here. I mean, God, you should have seen the purse my mom carried. Okay, but you know, I mean, huge, and she was this tall. But if this is distorted, you're distorting the ribs. Okay, does that make sense? So when you see a thoracic distortion like this, that's hugely important. So what's going to happen is, let's say that you were in a crazy world that wouldn't look at any structural or neurologic issues, and you had trouble transferring oxygen, and knowing that good oxygen transfer will lower blood pressure, poor oxygen transfer will raise blood pressure, only because you got to get more blood to the lungs that aren't efficiently working, okay? So high blood pressure, not high blood pressure. High blood pressure, not high blood. Okay, does that make sense? It's an adaptation. So when you see this, the muscles that run down either side of the spine, they're not under conscious control. So this is the crazy part. So if for every 1 inch that head goes forward, the pressure on the disc double. So if you have massive forward head carriage like these people, I know not you, but the person in the cubicle next to you, that person's got a crappy posture. Like that? Okay, good, just checking. Okay, so with that head forward, all these muscles, because the body's smart, it's going to be firing off to reposition that, to pull it back. But what do most people do with a tight muscle? Relax it. And it's like, holy moly, that's insane. Particularly if you've had somebody that's had some kind of a trauma. All of these muscles here are going to be firing off to get it straight. All the muscles here are going to be firing off to get it straight. And if the head's forward, all of these muscles are. And if you relax those muscles, which way is the head going to fall? Bam, further forward. So what I would tell the students, find out why the muscle's in spasm first, because it may be trying to fix a problem. Okay, does that make sense? Okay, so now I'm going to give you an exercise. That's Dr. George down at our clinic in Mexico. No, he doesn't really sit like that. I said, and he's thank God he's a good sport. Okay, so we have to go over to correct this. Now, number one, you're not going to have a rounding over the shoulders and a perfect cervical curve or a perfect lumbar curve. So this is why you have to look at everything. So what did I just say? All the muscles that support the head stop here at the top of the thoracic area. So bam, you've had a forward head carriage, loss of curve. Those muscles are going to tighten. That's going to make that area almost impossible. You may be distorting the curve, increasing the kyphosis to take pressure off the nerves. There's a lot of things you got to do. Understand why that curve, that hyperkyphosis is there first. Then when you've ruled out everything, and this is directed by the chiropractor, this is the exercise you can use. Now we use this, which is a very, very tight foam piece that's not really compressible. Now, if any chiropractors are watching this, a 4-foot link costs $15. Okay, am I the only cheap one in here? Aren't you gonna say, you're kidding, a stupid foam thing, 4 feet long, costs 15 bucks? Yeah, okay, and we get about 8 of these things out of it, okay? Because, you know, so we're gonna, and it's about 7 inches long. Generally, when you're sitting, it's placed at the bottom of the elbow, is the bottom of the bottle, so it's back, or the bottom of this. This one, we're gonna place in between the shoulder blades. Just like it is up there. Now, when you lay down, this is the most uncomfortable a thing that you could possibly imagine, because if you've been around like this for years, all the muscles in between the ribs are going to get tight. There's going to be very little motion or fluid into these joints. So when you lay this down, uncomfortable is putting it mildly. And I would do this under the direction of a chiropractor or somebody that knows. You'll see his head is floating above the table because he's a young guy and he can't bend back, okay? Because the intercostals are too tight, there's not enough hydration in the disc. So at the start, you may need to have a slight pillow there to take the pressure off. But when you lay on this, the most important aspect is to deep breathe. Because deep breathing increases the intrathecal pressure inside of here, and it forces the fluid back in the joints. And this does everything. So imagine if you're there knitting, if you're doing woodwork, if you're sanding, if you're working at a desk, anything. Okay, will this be an invaluable tool? Absolutely. Now, I would only recommend a foam piece or a rolled up towel. Now, when you're sitting, you could use a plastic water bottle, glass water bottle if it's thick enough, everything else. But if you lay on a glass bottle like this and there happens to be a crack in it, we're both visualizing. It's like, oh God. Yeah. So make sure it's not something breakable you're laying on, okay? And make sure that you're following the advice, because I know a lot of people, worst number of fractures I've ever seen. There's 12 thoracic bone here. Worst patient was 11 of these were fractured. Okay, 3 of them were new fractures, but most of them were over a few years. And osteoporosis doesn't come from weakened bones. It comes from acidity of the blood. So the body goes to the bone bank to withdraw the calcium to alkalize the system. So you got to correct a lot of things. This is not an exercise for everyone. You have to get approval for it first. And when you look at this, there's a tremendous amount of muscles there. Don't look at the muscles. They're there for a reason. But also we can look at this because we've got this big triangular bone back there called the scapula. So we're going to be using that scapula in order to correct thoracic deviations. Now, number one, forward head carriage, you can see this guy's back. See the brown area there? It's flat, okay, the top of his thoracic area, and it should be curving around. And that typically is an adaptation from a deep-seated stress on the central nervous system. And again, just take a look at this. And this is why observation is so hugely important. This person had an accident, had been thrown forward. Now, are they going to walk around like this? No. So what's going to happen where the back curves out here in a normal human being, it's going to dip in. So then what you're going to see a hump at the top, and people will call it a buffalo's hump. Okay, it's not a buffalo's hump, okay, but it is an adaptation because it turns out the nerves that come out of the top of the thoracic area supply the heart. So when you see a bump like that at the top in a flat where it should curve out, that bump is protecting the heart. And you can say, wow, you know the heart palpitations you've had? You know, I'm talking just a little fluttering. That's where it's going to be coming from. Now, when you look here, the nerves that supply the heart, there's 2 nerves. One comes out of here, that's the parasympathetic. The other one comes out of here for origins called the sympathetic nervous system. Now, the way the body works, imagine if it was an intelligent design. I know it's really hard to think of. Okay, the first day of anatomy, you're going to look at this and think, my God, it's brilliant. I mean, we know that you know, environmental adaptation for sure, but there had to have been some intelligence in this design. Had to be. Now, what happens is, everyone's seen movies where, you know, somebody has a heart attack, they grab their left jaw, left arm, left everything. That's because when you irritate the heart that's sitting on the left diaphragm, that left diaphragm triggers the spasm of the trapezius muscle, which is up here. You know, everybody's seen that, okay? What they typically don't see, and what they actually are teaching chiropractors, is that chronic right shoulder spasms could have to do with the liver or gallbladder, because that also is a referred discomfort. So under any physical, chemical, or emotional stress, the liver's got to work harder, and the gallbladder's got to work harder, so that can increase the stress. So this is the natural off button of the body. And this was, well, actually elucidated by a study that we did at Cleveland Chiropractic College, LA, back in the 90s, where we had, we were doing a monitoring study where people wear monitors for, I think it was 24 or 48 hours, and to see if the cardiac arrhythmias were being affected. Well, the doctor that was running it, got all of these heart monitors, went up to the heart monitor shop, and met a doctor who had a clinic for opioid addicts, okay, that were recovering from actually opium. Not this is before. This is the 90s, before the major opioid crisis. I can't stand saying opioid crisis, because it's like these drugs are attacking people. No, it's the stupidity of the medical system that's giving a toxic pain reliever to cover up the symptom that their body is doing. So this is totally created by the medical system, not by, you know, that evil drug, okay? So, but he would find that these patients, a lot of them would die of a heart attack when they were getting off of the opioid addictions. And the doc said, have you ever checked for a right rotation or a rotation in the upper thoracic area? And he said, what would that have to do with heart attacks? Well, think of this. Physical, chemical, emotional stress. You've got the trapezius up here on the right, and it's going to increase tone of these muscles, okay, over here, pulling this right rotation. And you can see in the upper, these are people facing us. So when I say right, it's really left-hand side. You're seeing a significant right rotation of that upper thoracic area. And when you see this, you can say, wow, have you had heart palpitations? And they'll say, of course, what is that? You know, you get a little fluttering, and you take a deep breath and it goes away. Absolutely, okay? And this is where it comes from. So when this doctor that had this opioid clinic or opium recovery clinic, they started to incorporate getting that area adjusted off to de-stress out the body. And they went from about 15 to 20% cardiac issues to nothing. And because it is, that liver's got to work harder and harder and harder, and it just makes perfect sense that there'd be an off button put inside of the body. So you're being tortured by a relationship, tortured by prison camp, tortured by the media, okay? Okay, that gets more and more and more pressure on there. Eventually, the nerves get so locked in or so hyper sensitized that this fires a sympathetic charge down to the heart, because this is the sympathetic nerve supply to the heart, putting the heart in ventricular fibrillation, stopping the heart. So when I see somebody with a rotation like that, it's, damn, okay, let's get you better, because you got to fix that. Now, for all the chiropractors out there and physical therapists and everybody who's working on human beings, and if you're not working on human beings and you call yourself a doctor, change your name. Because you can't fix anybody by giving chemicals. Humans don't work that way. You got to find the actual problem. So this is what you do. When you have a significant rotation, and again, let's say these are rotated to the right. Okay, and this is the person facing us because this is their back. Okay, if you turn your head to the right, okay, watch what happens. So I'm going to have this person look this way. Watch what happens to these vertebrae. See how they preload? They kind of move over to the other side. And this is what we'll tell people. If we see a rotation to the right, we'll say, you know, during the day, if you got a chance and you're typing and you can look to the right or look to the left, look to the right. Okay, if they're rotated to the left, look to the left. Okay, so this way, you're de-stressing that area out just a little bit. And so this is the adjustment for a right rotation. She's laying face down, turning, and then we're driving that down, okay? to de-stress it out. But I mean, that's only part of it. Then you got to restore the curve in the neck. You've got to give that foam piece exercise so they're sitting, so they're de-stressing it out. Everything has to do with this nervous system. When you're looking that this nervous system well, the spinal cord isn't like a bunch of nerves, like a bunch of telephone cords. It's literally a long tubular brain. It has its own action. This is why somebody can have damage up here and their organs are still functioning correctly. So I want you to look at it a little bit different. Now, the cord isn't one diameter. Okay, it's called a cervical enlargement, where it goes big here because you got the brainstem, goes really big because you got the brachial plexus, and then it gets real thin through here because it doesn't need to be thin. Then it gets larger at the base because this is where the lumbar plexus comes off, and it looks so big and it's so cool looking. That's why I have a real honest to goodness, real cadaver sample of a spine here. Okay, I know. If you're watching this, come on by. It's really cool. It was dissected back in the 70s. But you'll see at the base of it, this bundle of nerves is so pretty. They call it cauda equina, or horse's tail, because it's so big there. But knowing that this is the most narrow part of the spinal column, that if you have any structural deviations, you're going to have an issue. Now, if you supply or pinch one nerve, you're going to have one action, okay? And it's called a dermatomal pattern. Dermis is skin, tomal means the nerve supply that supplies that area. And this is also interesting because we're seeing a massive rise in shingles because of certain medical interventions that we can't talk about. But in the old days, we would have things called, Doc, what were they? Chickenpox parties. Okay, according to my sister, I infected most of the neighborhood. Oh, little John's got chickenpox. Bring him over here. It's summertime. We want to infect the whole household. So super spreader. Well, since they came out with this intervention that suppresses the natural childhood infection that everybody would get, and these kids would reinfect adults. And so there was always that immune system boost, which was like absolutely fantastic. But now that we're suppressing that, we're seeing that they're not getting boosted. And then even some of the other interventions that we can't talk about are actually making it worse. So we're seeing a rise in shingles. You should see our shingles video, but I think it's been deleted because we talk about medical interventions. Okay, but what happens is, this is a virus or a pathogen that lives at the nerve root ganglion. So it presents in one dermatomal pattern. This is why when somebody has blisters and red and pain going along one line, I mean, a blind man should say, wow, man, that's shingles, okay? But again, it's not a virus that's attacking the body. This lives at the nerve root ganglion. So physical, chemical, emotional stress are going to activate it, and structural deviations are going to activate it. So you have to look at all those things. So to suppress it, it's really easy, but you can check out our videos on that. It's just, you got to get the body working healthy, look at your physical, chemical, emotional stress, and you'll suppress it and it won't be an issue. Now, you're going to see thoracic are also listed as dorsal. Now, it's interesting. You'll see D12, which is the 12th dorsal down here. And this is one of the questions that I would always ask the students. So what's the most important bone in the spine according to D.D. Palmer? And every one of them, okay, and this is one of the founders of modern chiropractic, even though chiropractic goes back to 2700 BC in China, a guy named Kung Fu wrote down moving the bone to affect the body. He said D12, the 12th dorsal, is the most important. Why is this one the most important? Because the spinal cord stops there. Any pressure on this area negatively affects the whole gastrointestinal tract. It's called cauda equina syndrome. It's amazing, but you can look, liver, spleen, pancreas, all of these organs are supplied by these nerves. So taking care of all the nerves that supply the organs, since the nervous system controls and coordinates everything in the body, do you think it's important to pay attention to this? Yes or yes? Okay, so this is how you assess it. Now, for those people that don't understand how you can correct a body, you got to find out. So here's a scoliosis of 67.9 degrees. Now you got to know, how can you tell the person that you can fix it? How can you say, you know, what's your goal and what data are you using? So you got to take this and you're going to take an x-ray of bending it. Now this thing doesn't bend, okay? It's stable, it's not going to move, it's fused, okay? But if it does change, that's the minimal amount of correction, not maximum, because right now we're just seeing what the length or what the structures now are limiting. So we're looking at the muscles, the ligaments, the bones, okay? We're looking at proprioception. This is how the body moves. So that's the minimal amount, because we can change the muscles. You can change the shape of the disc. You can change the ligaments and bones. Okay, we're just seeing what's right there. And so this goes from 67 down to 31. Totally cool. That's the goal. Her post x-ray turned out to be 49.9. So, you know, reduced it, you know, several degrees. So that's kind of cool. And you go from 67 degrees to 49 degrees. That's called, what is it? Improvement. I know, duh. Okay, here's another one, okay? 39.8 degrees, the bending film went down to 18 degrees. Resultant was 35 degrees, okay? Here's one, hemivertebrae. Now, when you're looking at this, if you're looking straight, they kind of look square, even though they're really round. A hemivertebrae means half of that vertebrae didn't form, or it forms like a wedge. Or sometimes they fuse together. So there's a whole bunch of things. This happens to be a hemivertebrae that fused. So you have bones that aren't the same shape. So what are you going to do? Well, it was 69 degrees, 69.4. The bending reduced it down to 35 degrees. And the resultant, after I think it was like 4 months, was 58 degrees, so 11-degree reduction. And so when people say, oh, I got a congenital anomaly, the bones are fused, they just never formed right. It's okay, you got other bones that are probably formed right. Okay, so it's, and again, we're just talking basic common sense. This isn't, I'm not magical, the stuff we do here. I mean, I put a sign up, expect miracles, because people don't know that their bodies are miracles. Okay, they don't know that they're more energy than matter. They don't know that this is one of the most ignorant societies the world's ever seen. They think they're advanced. Okay, I mean, just watch the person at the bus stop wearing a mask, okay, using Purell, cancer-causing agent. Okay, yeah, that's an advanced animal. Okay, so when we look at this, if you have a structural deviation, we got a scapula back here. Let's use it, okay? So let's apply it. Now, what's interesting, one of the ways to do it, now, if you have a rotation at the top, let's say it's a right rotation, what will I tell people to do? Rest your right arm, and I'll tell them, do you want to do the right arm or the left arm? Right arm on the couch. Okay, because that's going to lift the scapula and apply a little bit of pressure in that direction. You know, it could be the left side based on the x-rays. You know, if it is a left rotation, I'll ask them, I'll say, which way is the government leaning? That's right, so put the left up. You know, any way that they can remember, because you know when they leave my office, they're going to go, honey, I don't know, did he say right or left? Oh, he made that joke about the government. Yeah, so now we're going to show how to hydrate the discs. Since the discs are 70% fluid, you got to fill them up. And this is the scariest exercise in the world. And I mean scary, because figure this. People that come in that have had chronic pain, they're moving really slow, because they know that when they move, oh, the back goes out, okay? So this is the scariest exercise in the friggin' world. Okay, what you're gonna do is mobilize this rib cage. It's also great for brain function. And you cannot do this exercise unless you've cleared it with your corrective chiropractor. Okay, so these guys gotta know what the heck is going on. But you gotta know that you have to move the body in the paraphysiologic range of motion. Go on, say it with me. What's that? Again, it's Latin terms, so I can really impress you. But when you look at it, look, active range of motion is how far you can move it. Passive is more than that. Paraphysiologic is that area that you can only be in for a fraction of a second because you could damage the tissue. I know, say it with me. Whoa. Okay, it's really kind of cool. So what you want to do, you're going to move your body in such a fashion that you're in that paraphysiologic range of motion just for a moment. Now, you can turn this way and you can turn that way hard. Okay, but we got to get that snap. So if you think that this is like, you know, maybe 10 pounds of meat, okay, and here's another 10 pounds of meat and bone. So this is more like a 20-pound sledge you're swinging over your head. And if you get that momentum swinging it around, it's going to carry you, okay? So you lock your hands like this, put your feet wider, and you're not going to just turn like that. You're going to throw it so you get that snap. And you're going to do 100 of these, 100 of these, okay? And it's going to help with the brain. If you're tired or anything else, you're going to be pretty darn energized afterwards. It's pretty cool. I know. Well, I demonstrated all day long, so I'm actually pretty flexible. Okay, but this is a great way to hydrate the disc. Okay, now, hiatal hernia. Again, this has to do with the thoracic area because the diaphragm is located on this. They call it the great mimicker, heart palpitations, chest pain. Why? Because you've got the diaphragm here that's attached to the bottom of the rib cage area. Is anybody finding, because like I did cervical series last week, thoracic this week, did you kind of show up and think, well, I don't know, sometimes it's entertaining, but I'm not really interested in the subject matter? No? Okay, good, thank God. Okay, because I think it's really cool. So you got the diaphragm that's attached to the base of the rib cage area. Now you got a couple of holes. One of the holes that goes through that flat, wide muscle that goes up and down when you're breathing is the esophagus, the food tube. Now connected to that is the stomach. Now if that diaphragm is weak, then the stomach can pooch up inside. And what's on top of that? You're talking the heart. You're talking the lungs. So every time you take a deep breath, you get that sharp pain right in your chest. So I mean, a hiatal hernia is horrible. The nerve that comes out of the neck supplies that muscle. That's why C3, C4, C5 keeps you alive. That's the phrenic nerve. So if you have, say, a reverse curve like this in the neck, do you think they might have altered breathing function? Go, I know, say it with me. Duh, come on, give me a hard one. Okay, well, are they going to have blood pressure issues? Are they going to have anxiety issues? Because that little brain burns about 80 to 90% of the body's oxygen. So seeing that reverse curve, do you think they're going to have chronic anxiety or stress? Yes or yes? I know, it's just crazy. So to correct the hiatal hernia, you got to correct the curve in the neck and you got to strengthen the diaphragm. So we tell people to diaphragmatic breathe. This means that when you breathe, your chest isn't coming up and your tummy goes in. That's breathing like an American. Okay, what you want to do, you breathe in, the tummy comes out, goes in. Now what that diaphragm is doing, it's moving all the organ tissues around. It's actually helping lymph flow. This is how children breathe. This is how we want to teach everyone to breathe. But let's say that that stomach is pooching up inside. So you take your left fist. How do you say left? Yeah, which way is the government leaning? Okay, so left, I know, it's going to swing back to the right eventually, okay, and then it'll be too right conservative. You know, we're eventually going to find balance. But the left side underneath the rib cage on the left, and we want it right underneath that nipple region because that's kind of where the esophagus comes through. And you're going to breathe in, and when you breathe out, you push in and pull down. So you're literally pulling that stomach down. So breathe in, then blow out. And you push in and pull this down. And this is literally going to be pulling that stomach away from the diaphragm. And you can do it 2 or 3 times, okay? That helps. Some people can drink water and jump up, and there's no knowledge of anatomy or physiology. Okay, so look at our video on hiatal hernias. You're going to drink no water before a meal, half hour before, no water during, and no water half hour after. You want to increase the stomach acid, but it's very fixable. All of these medications damage the structures. So you got to heal the gut, and this is how to correct the rib cage area. We're going to talk about reversing arthritis this coming Thursday, and we're going to talk about how the gut flora is hugely important. I mean, here you go. What are you looking at this? You're looking at multiple rotational malpositions in the thoracic area. The neck is forward. There's multiple areas of damage. Grade 3 arthritis. And what was she diagnosed with? Does anybody think she has high blood pressure? Or does she have over 15, 20 years of damage in the neck? I mean, it's so clear. Sleep problems? No kidding. She's been in stress for over 20 years. You can see it right there in the neck. Anxiety? Of course. Reflux? The nerve that supplies the diaphragm comes out of the neck. All you got to do is look at this like a map and say, wow, we know where her symptoms are coming from. But in crazy world, and I mean crazy world, you give a drug to lower the blood pressure, which is going to increase her risk of stroke. You give her a drug to stop the acid production in the stomach, which increases esophageal cancer. You give her a drug, sleeping medications, which increase her risk of cancer through the roof. And fatigue. I don't know, diagnose her with adrenal fatigue and give her a Synthroid to help her thyroid out. Okay? I mean, insane. Health of the gut's huge, okay? Glucosiodine, plant-based, I mean, it's fantastic. If you got reflux, apple cider vinegar is good. Bentane hydrochloric acid only for about a month. Baking soda is okay. Aloe juice is okay. I mean, I'm okay with doing this a little bit, but remember, we're in an allopathetic society. Allopathic means you're prescribing something for a symptom. Allopathetic means you're doing that, prescribing something for a symptom and causing harm. Okay, like the majority of doctors are doing. So I don't want to prescribe this stuff for reflux, but if it's so bad and horrible and you haven't made it to the chiropractor to restore the curve in the neck and restore the diaphragmatic function, and you don't know how to do this because you're stuck in a crazy world, then do this, but no more than a couple of weeks, and then you're going to get better. Ginger root, slippery elm. So the 5 keys to health: you need a healthy nerve supply, regular exercise, nutrition, sufficient rest, and prayer and meditation. Okay? That's literally how the body thrives on this planet. Does that make sense? And if you do have a structural deviation of the rib cage, man, fix it. Okay? And I just showed you how to fix it, or how to say how far you're going to fix it. We're going to get into the realm of danger, okay? And that's why I started it off with John F. Kennedy on saying that censorship, that every idea should have fair balance. Mr. Kennedy, Robert Kennedy, is a patient here, and he said that an idea that cannot withstand the furnace of debate, okay, is insane. Every idea should be able to withstand that. Like if I say the world is flat or the world is round, we should be able to have a discussion on that. If I say that forced medical intervention, it violates that person's right, and you say no, without that forced medical intervention, and it violates everyone's right, we should be able to have that discussion. Okay? We're getting into an area where we can have that discussion. So those of you that are watching it on Dr. BVIP, continue watching. You'll see it uninterrupted. Those that are on Facebook and YouTube, God bless you.